And welcome in here to Live Now from Fox. My name is Christy Matino. We're continuing to follow this story that we brought you just yesterday. Now, this is a post from the CDC. It does say today, however, this was posted yesterday. As they said, the Advisory Committee on Immunization Practices voted in favor of removing the universal hepatitis B vaccine recommendation for infants under 2 months old. So again, this has come under some backlash here from medical and public health experts. The entire vaccine advisory panel was appointed by Health Secretary Robert F. Kennedy Jr., a vocal vaccine skeptic who's overseen other big changes to vaccine policy. But I just wanted to quickly recap for you here what we did see unfold there yesterday. So the U.S. Centers for Disease Control and Prevention has for decades recommended the hepatitis B vaccine for babies to protect them from the serious liver infection. The shots are widely considered to be a public health success, but the Kennedy-appointed Advisory Committee on Immunization Practices recommended that the birth dose only be given to babies whose mothers test positive and in cases where the mom wasn't tested. For other babies, it will be up to the parents and their doctors to decide whether a baby will get the vaccine at birth. The committee voted to suggest that when a family decides not to get a birth dose, then the vaccination series should begin when the child is 2 months old. Committee members said the risk of infection for most babies is very low and that earlier research that found the shots were safe for infants was inadequate. I want to bring in Dr. Richard Besser. He is the president and CEO of the Robert Wood Johnson Foundation and former acting director of the CDC. Thank you so much for taking the time this morning to break this all down for us. We truly appreciate it.
Good to be here, Christy.
I want to start with actually the history of the hepatitis vaccine and what we've seen in terms of cases and its effective rate here.
Yeah, so hepatitis B, it's a very contagious virus. And back in the 80s, a vaccine was developed to prevent hepatitis B infection. That did a pretty good job at reducing the number of cases of hepatitis B. But in 1991, what was recognized that although the number of cases had gone down, there were still thousands of cases occurring in children. And that was despite having an approach of screening moms, looking for high-risk individuals. So the CDC and medical societies recommended that all babies get a hepatitis B vaccine at birth, and then they continue and get the other 2 shots later on. And what we saw was pretty much an elimination of hepatitis B. And the reason hepatitis B is an important infection to prevent is not because of what happens immediately when you get that infection. Most children actually don't have any symptoms. But what can happen if your body doesn't clear that virus, over time, it can lead to liver failure and it can lead to liver cancer. I practiced pediatrics for more than 30 years. And to me, it was pretty miraculous to watch that disease go away. It wasn't something we had to worry about. So to see this committee try to solve a problem that didn't exist, it's taking us back to where we were 30 years ago. And I worry that we're going to start to see hepatitis B come back. And unfortunately, over time, we'll see liver cancer, liver failure come back that could have been prevented.
And going off of that, I just wanted to share with our viewers here this post from U.S. Senator Bill Cassidy, who says, as a liver doctor who has treated patients with hepatitis B for decades, this change to the vaccine schedule is a mistake. The hepatitis B vaccine is safe and effective. The birth dose is a recommendation, not a mandate. Before the birth dose was recommended, 20,000 newborns a year were infected with hepatitis B. Now it's fewer than 20. So a lot of what you've been saying there, Dr. Besser, about this. I wanted to also just ask you, though, what are the potential public health implications of this new recommendation? I know you've touched on this a little bit, that you're concerned that we're going to see this go up here. But when it comes to what we could expect in the future, what are you anticipating?
Yeah, I mean, first, I want to thank Senator Cassidy for his leadership on this. It's been really important to see him, someone who has such expertise in this disease, speaking out so forcibly. What we're going to see are a number of things. We're going to see confusion and parents who want to do the right thing by their children, hearing information from different sources that is conflicting, and that always bothers me. What I would recommend is that parents talk to someone they trust. Talk to your child's doctor, your pediatrician, your family doctor, nurse practitioner, or pharmacist, someone you trust to help sort through this information, because the real value is getting this vaccine as early as possible, so that any chance of infection early in life is prevented. The Academy of Pediatrics is a good source of information. They're continuing to recommend that all newborns get this. You can look at what your health department is recommending, but it is confusing. And from a public health standpoint, what I worry about is that there are many people who want to do right by their children who are going to make ill-informed decisions because of this new recommendation.
I also wanted to ask you how you interpret the panel's argument that the risk of infection for most babies is low and that earlier research wasn't adequate. What did they cite to have them come to that conclusion?
Well, the risk to any one child is low. And that's the challenge here, is that because the risk to any child is low, it's very hard to identify those children who end up getting infected. The approach of identifying high-risk children was what was used before, and we continue to see thousands of cases. So this approach of vaccinating every child with a vaccine that is incredibly safe, this is a vaccine where we haven't seen any real problems. I don't understand why they're coming at it from this angle, and it's very concerning. We have a Secretary of Health who was a leading anti-vaccine crusader before he became secretary, and he's installed in this committee people who agree with his beliefs on this. No parent has to give their child any vaccine they don't want to. That's always been the case. A parent has to approve. But to say that the CDC doesn't recommend it flies in the face of the science that we've known for decades.
Now, I wanted to touch on that because there are some people that are concerned about vaccines. Could they lead to certain diseases or issues in their children? What do you say there about the research and what that all says? What does the science say when it comes to vaccines?
Yeah, I mean, I practiced pediatrics for more than 30 years, and I know there was nothing that I did for my patients that had more lasting value for their health than helping to ensure they got vaccinated fully and on time. But to do that, it meant spending a lot of time with parents, making sure that their questions were answered, treating each one as a person who had the right to make the right decision for their family and their child, and that still holds today. What worries me, there are a lot of people in America who don't have a doctor, don't have a trusted healthcare provider, who go to community clinics for vaccination. And I worry that as they make decisions on their own, they're not going to have the input that they need. And that is a real problem for many children. It's so important that you get your questions answered. But there's so much misinformation that's out there on the internet. You should get it from someone who you truly trust, who understands the science and the health of children.
And Dr. Besser, that was one of my last questions for you, because to wrap up here, the panel suggested that doctors and nurses often don't provide all the information about the pros and cons of the birth dose vaccination. So how can healthcare providers ensure parents are fully informed? Or on the other side of the coin here, what questions should parents be asking?
Yeah, I mean, the committee is instilling fear. To say that your doctor isn't telling you the full story is suggesting that there's this conspiracy to harm children. I've seen over the course of my career the development of so many different vaccines that have eliminated diseases that cause children pain, families and parents incredible heartbreak. And to me, that's the value of science. You want to look at diseases, look at how to prevent them, make sure that anything you're going to provide is safe. And that's what's done here. And over time, you want to monitor to make sure that there's nothing that you didn't see early on that comes up. This is a very safe and very effective vaccine. I would hate to see a committee raise concerns to parents that their doctors, their nurses, people they trust are hiding something from them. That's just not true.
All right, Dr. Richard Besser, thank you so much for coming on the show this morning. We appreciate it.
Thank you so much.